Okay, this is our last video on these slides about pharmacodynamics. So one more thing I just wanted to give a quick introduction to is about the pharmacodynamics of antibiotics. This is a really interesting area to me. You'll learn more about this next year in ID. Dr. Lewis will be teaching you, maybe even in renal you start. I think I come in and teach a little bit about this with Dr. Lewis. About some of the antibiotics. So what's interesting about this is we have learned a lot about how actual antibiotics work and what our target should be as far as their drug concentrations. So some drugs, it's all about making sure that there's enough time over the MIC. Do you remember what MIC means from microbiology? It's your minimum inhibitory concentration. So it's the minimum concentration of drug you have to have around to inhibit the growth of a bacteria in this case. So these drugs are what we call time-dependent killers, which means we just need to make sure there's enough drug around to be over that MIC to kill the drug. I think of this as like radiation, like or an annoying neighbor that's just constantly annoying you at a low level. So if here's your MIC, so here's your concentration. If this is your MIC, you just have to continue to be above it as much as possible. So this is time over the MIC. Sometimes it's reported as your percent of your tau over the MIC. So what percentage of your dosing interval are you above the MIC? So these are time-dependent killers. So what we're going to try to do is just make sure that the concentrations don't fall below that MIC. Okay? The next group of drugs, the target is to make sure the area under the curve is over the MIC as much as possible. So this includes fluoroquinolones, vancomycin. We now will be using probably area under the curve targets to make sure we have enough vancomycin on board and not too much on board. Area under the curve, of course, is going to actually look at exposure. So area under the curve exposure is looking at how much drug you're exposed to over time. It's not just a concentration, which is a point in time. It makes sense that this might be a good thing to correlate both efficacy and toxicity to, right? So these drugs all fall in that area under the curve over the MIC to target. Finally, we have what we call, I'm going to use a different color because they are different, concentration-dependent killers. So with these drugs, we don't care so much about being just maintaining a concentration above the MIC, but let's say here's the MIC again. What we want is a very high Cmax to MIC ratio. So you want, I think of this as like the boxer that comes and wants to give a punch. So you need to knock that thing out. We're going to give a punch. So these are concentration-dependent killers. The biggest ones are aminoglycosides, where we want to make sure we get a very high Cmax to MIC ratio so that we can punch that bacteria out. So these are concentration-dependent killers, time-dependent killers, and these are exposure-dependent killers. You'll learn more about this, but it's interesting to think about. We have very different goals then for each of these types of drugs as far as what we're going to monitor for efficacy with pharmacokinetics, right? So for efficacy for time-dependent killers, what are we going to be looking at? We want to make sure that our percent of our tau over MIC is as big as possible. We want to keep that concentration over the MIC for as much of our dosing interval as we can. Concentration-dependent killers is going to be Cmax to MIC. We want this as large as possible, right? We also will be counting on the post-antibiotic effect. Hopefully you learned about that a little bit in micro, But what that means is that antibiotics will continue to kill or inhibit bacterial growth even when they fall below the MIC. So this is called the post-antibiotic effect. We have to count on that for dosing these drugs. I'm not going to spend a ton of time on that here. And to look at toxicity, we look at sometimes area of the curve will help us. We want to make sure our area of the curve isn't too high, so we want to minimize our MIC. So there'll probably be a sweet spot for that, just like a therapeutic range. So we want to make sure it's high enough to be efficacious, but low enough to not be toxic, right? Also, for some drugs, we think if you have a drug-free period, that might help with toxicity. So for example, with aminoglycosides, they attack the nephron, specifically nephron. They attack the cells that line the proximal tubule, and aminoglycosides will go in there and kill those cells. So if you stop the aminoglycoside and give a drug-free period, those cells can regenerate and you can avoid some toxicity that way. And I think that's it for this. So we've got another topic down. Thanks a lot. Okay, bye-bye.